In this present crisis, government is not the solution to our problem. Government is the problem.
Okay, this is today, Washington State Health Department officials. Observe and watch their body language, watch their pauses, their ums. And I mean, seriously, these people don't know what they're talking about. They're struggling to come up with answers that fit the narrative. And, they just want to continue to make people in fear and be the sheep that they are. Anyway, check this out.
I'm just wondering, with this new guidance from the CDC that says, isolate, or, you can isolate for 5 days and then emerge and then wear a mask for another 5 days. Are you concerned that that sends a mixed message about mask wearing when we go out, when we should all be wearing masks when we're around other people anyway?
So this is a great question, and actually I really appreciate the question, and want to note that in our media release that signaled we will adopt the CDC's isolation and quarantine guidance, we do note that mask wearing should continue after and beyond your isolation and quarantine period in any indoor public setting. I would also say we recommend for all Washingtonians, including those not emerging from isolation and quarantine, to wear high quality, good fitting masks right now, given the level of disease that we're seeing and the infectiousness of the Omicron variant. Dr. Kwan-Get, do you want to add anything?
I agree. I think the only thing I would add is that the Omicron variant does have more ability to aerosolize than prior variants. And so that means that it can more easily escape regular surgical masks. It can more easily escape regular surgical masks. And so that's why it's not only important to be conscious of masking and masking in indoor public spaces, as Lacey said, even after the isolation and quarantine period is over, but also to up our game in terms of the quality of masks that we're wearing. So preferably wear a KN95 or KF64 or KF94, or if you are wearing a surgical mask, to double mask, and not just wear a single mask. So so I'm really glad you raised that issue, because masking is something that we need to continue doing, and the CDC guidelines don't affect the mask guidance that we have. If anything, Omicron just makes it even more important for us to follow masking guidance.
Hi there, it's Dee Dee here with Cairo 7. Thanks so much for taking time to take a few questions. I have a two-parter. One is, we just heard from you, Medicine, that they won't be able to accommodate testing for people who are asymptomatic or have not had exposures because of the sheer number of positive tests. I was just wondering, how concerning is that for the DOH in terms of, both what's going on, but also not seeing all of those numbers reflected, though we'll certainly see positivity rates. And then the other question is, the CDC director said part of the reason for the change in guidance is because of the economy and for business reasons, and staffing reasons for shortening that quarantine time. Is that also part of why the DOH decided to follow CDC's guidelines?
Maybe I can take an initial stab at your first question and then allow Lacey to follow up. So yes, we have heard about overload of the testing systems in many laboratories. As far as surveillance for Omicron, we at the state are shifting to, or have shifted to, a strategy where instead of trying to count every single Omicron case, we're trying to get a better picture of what proportion of positive cases in the state are due to the Omicron variant. And so to do that, we are testing a sample of variants and sending them for complete genomic sequencing to determine if they're from the Omicron variant. And so this is something we've been doing, throughout the pandemic. It's not something new with Omicron. Initially, we were very focused on counting Omicron cases when we were trying to gauge, how quickly is Omicron establishing a foothold in the state. Now that we see that Omicron is quickly becoming the dominant variant in the state, we've shifted gears from counting individual Omicron cases to sampling a percentage of all cases for genomic sampling. So while testing capacity at any lab is a cause for concern, I think the overall the main metric we're following, which is the percentage of cases that are Omicron, is something we'll be able to continue. Is there anything that you would add to that?
Lacey, did we?
On
no,
the,
there you are.
yeah, I'm here. Sorry. On the second question, so I do understand, and I had heard the similar report from the CDC. I do want to emphasize that this is grounded in science. The majority of transmission does occur early in the course of illness. I think, if I remember correctly, generally the 1 to 2 days prior to onset of symptoms, and then in the few days after. So this transition for shortened isolation and quarantine is grounded in science, and also helps society keep running. And that is also important in a pandemic.
Thank you. Our next question comes from Nicole. Go ahead.
Hi, good afternoon. I'm wondering what percentage of new cases and hospitalizations are breakthrough cases, if you know that. And then considering that the first vaccinations happened a year ago now, at what point will our vaccination cards be considered invalid or too old if we don't have boosters?
We do have a publicly available report on breakthrough vaccination. I don't have that. I don't have those numbers at my fingertips.
Oh, he's got the data. He just doesn't want to say it in a public interview. And do you think the media is going to follow up and do their research? Hell no. They're as much as sheep as American people are.
But I can get that to you after the media briefing.
And on the second question, there's not a point at which your card becomes invalid. Just to clarify, the card is a documentation of the vaccines that you have received. What could change as we learn more science is what the CDC considers complete for a series, based on age or health risk status and what we know about the number of doses needed. So, at this point, there's not a change. So your cards are still valid, even if they're a year old. 2 doses is considered fully vaccinated. We still encourage everyone to get a booster because it does appear to really help prevent infection with Omicron for people who are, eligible. And a reminder that for everyone, vaccine is extraordinarily protective against severe disease.
Have you noticed that as everything around you seems to decline, one thing still grows? It is the power of your rulers. None of their plans and directives have solved your problems or made your life better. The only result has been their increased control over you at the cost of your freedom. Do you know why? You gave them the power.